My name is Carl Doghramji.
And I'm Paul Doghramji. We're two brothers who are also doctors. We grew up in an Armenian family, and our parents brought us here as kids to the United States of America, the land of opportunity.
We've always had dreams of becoming physicians and helping our patients to become as healthy as they could possibly be. Our show is about health issues that are important to you, baby boomers like us. We'll raise lots of questions and seek some answers, but ultimately, the decisions are up to you. We'll even have some fun along the way, and so, the doctors will see you now. Hi everyone, welcome to The Doctors Will See You Now. I'm Dr. Carl Doghramji. My brother and I are going to talk to you today about some important health issues. These may be affecting you and your family. And we're going to try to help you decide for yourself what's best for you.
And I'm Dr. Paul Doghramji. And you know, many health issues are not black and white. They can be complicated, and sometimes there are no easy answers. We've never been ones to shy away from controversial topics, and we won't shy away from them here either. And we'll have some guests here to help us explore some of the answers to tough medical issues.
Now, sometimes Paul and I will disagree. Of course, I will always be right, and Paul will always be wrong.
Very funny. We'll look at what's hot in medicine, and we're going to be the first to know, and we want you to be the second to know. I'll go along with that sleep long enough and at the right time most nights. But I think it's okay to mess up sleep now and then. Just like if you mess up your diet now and then, it's not going to kill you, okay? But what about when sleep goes bad, Carl? I mean, sometimes you want to sleep and you can't. And of course, that's insomnia. Right. Let me give you an example of a 45-year-old woman. And she has insomnia. She tosses and turns all night. She can't fall asleep quickly. And then she wakes up in the middle of the night and she ends up getting, let's say, 4 or 5 hours of sleep through the whole night. And she wants sleep medicine. And what does her doctor do? He immediately reaches for the prescription and gives her a sleep medicine. Now, in case you haven't noticed, Carl and I don't always see eye to eye on everything, right?
That's true, Paul, and it'll be very evident during our next segment, Doc Countdown Clock. It's a segment in which we'll have a fast-paced discussion about some of the hottest health topics of the day. Ready?
Ready. Topic number 1, deaths after chiropractic care. Carl, a recently published article on chiropractic cases showed how aggressive spinal manipulation, specifically of the neck, resulted in 26 deaths. Do the benefits of chiropractic care outweigh the risks?
Paul, I think we have to look at this article in context. It first of all looked at the entire history of chiropractic practice. That would be a total of 26 deaths in 75 years. Although we do not want to see any deaths, averaging it out, it's less than a third of a death per year.
All right. Next topic, calcium and heart attacks. A recent article showed 15 clinical trials in which the calcium supplements that many women take to boost their bone health might also increase their risks for heart disease. Carl, this can't be good news. We can argue about this stuff all day, so
yes, we can.
Danny, can you rescue us, please?
Please, Danny.
We're here with Jim Bumpensa. Jim is a fitness expert who's here to talk with us about how fitness affects our health and how to start exercising, even if you haven't done a lot of exercise lately. Hi, Jim. Thanks for joining us.
Hi, Danny. Thanks for the great intro. You know, Danny, fitness and your health is a topic that is really close to my heart. Within the last year, I lost my father due to a cardiac episode. He was very unhealthy. He didn't really take care of himself. And I feel that if he had been in better physical condition, he'd still be with us today. Fortunately, I was able to get my mother to start exercising, and over the course of about 6 weeks, she's lost about 20 pounds. Did you feel that in the back of your arms there,
Yeah,
Danny?
absolutely.
The progression from there would be to move to the floor. Again, we're still doing the push-ups, we're still working those same muscles. So it's down and up, still not locking the elbows. All right, Danny, so now we've worked the lower body, we've worked the muscles of the upper chest and the triceps and the shoulders. We have to work the back to offset the strength that we've built in the chest.
All right.
So follow these tips, and they'll help you reach your physical potential.
Well, thanks. Those are great suggestions.
Absolutely. Thanks, Jim and Danny. So, Carl, we're back again with Dr. Karen Aggersborg. Karen, it looks like you've changed into some exercise gear. Where are you?
We're at Famous Boathouse Row in Philadelphia, Pennsylvania. Specifically, we're at the Penn AC, or Penn Athletic Club, which has hosted many Olympians over the years.
And I understand your guest, Ted Nash, is a former Olympic champion, rowing champion, and current rowing coach. He's represented the U.S. either as a coach or athlete at least 11 separate Olympic Games, Paul, since 1960. He's in his 70s and he still races. Karen?
Can you tell me about some of the things that you did to lose weight? Like exercise, diet changing?
Well, I'd always done exercise, but what I did is I did more endurance than lifting. I did more endurance training. I went out and I ran very slowly at first because I knew even an athlete can get hurt if they run too much. And then I proceeded to do a lot of other cross training. I did a lot of bicycling. It's easy for almost anybody to cycle.
We don't always agree on everything, as you very well know. But seriously, one of the things we do agree on is the need to educate yourself to make the best possible decisions for your health.
That's right. And remember, if you have any medical concerns, make sure to see your physician or healthcare provider. And we'll see you next time on The Doctors Will See You Now.